It's one of the GOP's biggest hopes this November that voters will equate Paul Ryan with the Ryan plan to cut the deficit, and that'll get Mitt Romney into the White House. But that Ryan plan comes with a lot of strong medicine, including changes to Medicare that would replace full coverage with vouchers and could leave some seniors paying more out of pocket for their health care. A report by CNN Money hints that vouchers could spike health care costs for seniors, cut doctors, hospitals, and nursing homes from the system, and leave a two-tiered system, a private one for wealthy and healthy seniors, a public one for everyone else. Ryan's supporters take a different view. They point out that changes to Medicare have to happen or the system won't be able to provide full coverage in 2016 or 2022 or 2024 or later, depending on exactly who you ask and who's talking. Healthcare are not the only costs at the risk with the Ryan plan. His take on Medicare could potentially cost the GOP votes come November. Pew Research poll, only 34% of voters favor a voucher system for Medicare. 49% say no. Also, a majority of voters, 51%, don't want to cut the deficit at Medicare's expense. Then again, there's a lot of room for those numbers to change depending on whose message works best. Only 23% of respondents in the poll correctly identified Paul Ryan as the author of the Medicare voucher plan. 17% incorrectly think that it's President Obama's plan, and nearly half of the people in the poll don't know whose plan we're talking about. So we know people might be willing to vote against these voucher changes to Medicare. How many votes are there for voting in favor of the voucher plan? How many people will support it and make that vote based on the Medicare plan?
Well, I think it depends on how you communicate the argument. You have Obama's plan, which is no plan at all, and then you have the Ryan plan, which is saying we're not affecting seniors 55 and older, and to keep the system solvent going forward, we're going to have a system where people that have less personal wealth get more money, and people that need more health care get more money to pay for that. So it's a pretty logical thing. We're $16 trillion in debt, and it depends on how you communicate the argument.
Jessica is an excellent spokeswoman, and that's why they have her doing what she does. But the reality is, if you're a senior citizen who is 55 or whatever age you may be, do you think they're going to want to go to a voucher system in which you may have, it's been speculated, out-of-pocket costs of $6,500 a year?
But they don't want no program at all.
Well,
I agree with you on that.
This is why this is a landmark moment in the campaign, because for the first time in recorded history, both Republicans and Democrats are telling the truth. Democrats are telling the truth about the Ryan plan in that it would end Medicare as we know it, but the Republicans are telling the truth that the Obamacare proposal does trim $700 billion from Medicare Advantage. So the problem is a broader problem of debts and deficits. Because if you took every dollar of discretionary spending to zero in the budget, every single dollar, from the president's salary to what we spend on social welfare programs, not including Medicare and Social Security, there would still be a $4 billion deficit each month that the government runs. So I think we need to look at broader plans about how we examine the deficit crisis. There was such a plan. It was the Simpson-Bowles plan, which Paul Ryan happened to vote against when he was on that commission.
And Obama rejected it
as well.
Yeah,
exactly, right.
But how far into the details are a lot of voters or most voters going to wade? Or is this going to be a slogan
very
thing,
shallow, very
vouchers
shallow.
and cutting Medicare versus...
Very shallow. I think it all will come down, unfortunately, to who sells it better. Will the Republicans sell the Obama's going to trim $700 billion from Medicare Advantage, or will the Democrats sell Ryan's going to end Medicare as we know it? That becomes the question. I hope, and I give you credit for having a dialogue like this, that the voters will learn more about the Medicare issue because of this discussion.
Historically, Medicare has been a losing issue for Republicans. It will remain a losing issue for Republicans.
I don't know necessarily about that, because you saw the Medicare tactics worked in that upstate congressional race, but then the Democrats tried the same thing in New York 9 and it didn't work. They tried the same thing in the Nevada congressional special and it didn't work. And if you look at some of the polls in the swing states, Florida, which has this huge senior population, they've been polled on this issue, and most seniors, when you're asked are you more scared of a plan that cuts $740 billion from Medicare today, or are you more scared of a plan that changes the system over time, they overwhelmingly are on the other column.
It's obviously in the messaging, and whoever's messaging wins will probably win out. But yes or no, as we go around the table, will this impact the vote in Florida? Could this lose Florida for Mitt Romney?
I think we're going to win it ultimately.
It can and it will cost Romney the election in Florida.
Frank?
Yes, it will impact Florida. I'm not ready to say that Romney and Ryan definitely lose it yet. It depends on the messaging and how both sides sell it in Florida and around the country.
We got a yes, we got a no, and we got a maybe. That is the full complement of answers that we could possibly get to. We're going to take another quick break. When we come back, Stop and frisk. Most people in New York think the NYPD treats blacks and whites differently, but most people also seem to be okay with that. We're going to get into the numbers when we return.